Hello, my name is Tabitha Hicks, and I will be telling you about pulmonary edema. My purpose is to inform you of pulmonary edema. Pulmonary edema is a serious medical condition with several possible causes, varied symptoms, and differing treatments. First, what is pulmonary edema? Does it have a gurgling noise? Does it make you look funny? What is it actually? Pulmonary edema has a gurgling noise, which is often associated with it, as sounds like this. Pulmonary edema is fluid in the lungs. Pulmonary edema is a serious condition with several different causes, varied symptoms, and different treatments. First, I will tell you about the several possible causes of pulmonary edema. Pulmonary edema has a most common cause, which is known as congestive heart failure. Congestive heart failure is when the heart is not able to pump properly and blood backs up into the vessels that are being taken to the lungs. The pressure increases, forcing the fluid into the alveoli, also known as air sacs, of the lungs. Seen here in this photo, I have a normal alveoli air sac and a pulmonary edema air sac. Whenever fluid is in pulmonary alveoli, it causes less oxygen movement, and that means shortness of breath. Pulmonary edema can also be caused by a heart attack. Whenever a person has a heart attack that is dominant on the left side, the person's heart is damaged to where it cannot function. And whenever I say function, I mean by not pumping at the rate that it should. And whenever the heart stops functioning properly like it should, it is letting the blood back up. So when blood backs up, fluid is being pushed in the spaces, as in earlier. Also seen in drug overdoses. It's been seen in aspirin, heroin, and methadone. All of them have not really been determined as of why, but it has been noted in autopsies. This is being referenced from medicinenet.com. Pulmonary edema has many different types of treatments. The different types of treatments for pulmonary edema is oxygen, which is a positive pressure that forces fluid out of the lungs. Diuretics, which it lets the person excrete the excess fluids. And also cardiac medicines. Depending on the person, they will receive different cardiac medicines due to allergies and other medicines that they're prescribed. And the cardiac medicines are meant for the vessels to open up so that you would not have the blood backing up, so that there is no more fluid going into any open spaces. This is being referenced from a very long one. Here it is. It is being referenced from https://umm.edu/health/medical/altmed/condition/pulmonary edema. Pulmonary edema also has many different symptoms. Pulmonary edema has a shortness of breath, which is because of the fluid in the lungs that's backed up, which has made less space. A pink froth that is blood tinged. Why it is pink, that's usually a late sign. And the gurgling of the lungs, which can be heard with or without auscultation. In conclusion, pulmonary edema is a very serious medical condition that needs serious medical help at the time of recognition, whether it be early or late. It will help a person greatly if they go to a doctor and be seen early if caught. Thank you and have a good night.